Hello and welcome back to MLab 1231, Parasitology and Mycology. My name is Dustin Scott Brewster, and this is going to be the second of our four-part presentation on the intestinal protozoa. The first of four classes that we're going to cover for the intestinal protozoa is class SARCODINA. Class SARCODINA includes Entamoeba histolytica, Entamoeba hartmanni, Entamoeba coli, ENDOLIMAX nana, Iotamoeba buschlei, and NAEGLERIA FOWLERI. The general life cycle for all of these amoeba is going to begin with the definitive host ingesting an infective cyst stage from fecal contamination. That cyst stage then travels, into the intestine where excistation occurs and develops into a trophozoite. Those trophozoites then colonize the host by multiplying asexually by a method known as binary fission. This is like a budding action. And then cysts and trophites are passed in the feces of the infective host, where the life cycle continues on to the next host. The first organism we're going to cover on class SARCODINA is Entamoeba histolytica. Entamoeba histolytica causes amoebic dysentery and is found worldwide, but more prevalent in the tropics and areas of poor sanitation. Infection of Entamoeba histolytica begins with the ingestion of a contaminated cyst stage of the organism. The trophozoite for Entamoeba histolytica measures 12 to 30 microns. It has a nucleus with an even distribution of peripheral chromatin, a compact and centrally located karyosome, smooth granular cytoplasm, and it may include ingested red blood cells in the cytoplasm. So we'll start off here with the bottom left image, which is a trichrome stain of Entamoeba histolytica. We see the nucleus with a compact, even distribution of peripheral chromatin. This is the nucleus here. This is a small, compact, even distribution of chromatin. A centrally located compact karyosome. It's like a bullseye right in the center there. And then off to the left of this, we have an ingested red blood cell. And then the cytoplasm is smooth and granular. The cyst stage is a little smaller. It measures 10 to 20 microns. And on the immature side, contains 1 to 3 nuclei. And as maturation occurs, can contain up to 4 nuclei. And it also may have a cigar-shaped chromatid bar present in the cytoplasm. So on the right here, we have the 10 to 20 micron in diameter cyst stage of Entamoeba histolytica. This seems to be a more immature cyst stage with only 1 nucleus, and it does have a cigar-shaped chromatid bar present. So infection with Entamoeba histolytica can range from being asymptomatic on the lighter infection side to mild stomach pain, possibly loose stool and cramping. And then on the more severe side, a condition known as amoebic dysentery can develop with symptoms such as severe stomach pain, bloody stool, and fever. In addition to that, an extraintestinal infection can occur where the parasite invades tissues outside of its normal life cycle, such as the liver, lung, or brain, which would result in an abscess known as an amoebic abscess. Something to note about Entamoeba histolytica, and quite clinically relevant, is that it is the only pathogenic intestinal amoeba, which is why we're going to need to differentiate it from the following amoeba, which we'll cover here in just a second: Entamoeba coli, Entamoeba hartmanni, Entamoeba gingivalis, ENDOLIMAX nana, Iotamoeba buschlei, and Entamoeba fragilis, which is actually not going to be in this presentation because it is no longer classified in class SARCODINA as it is a flagellate. Something to note about Entamoeba histolytica is that it can be confused for artifacts if not trained. And on the left here, we have a white blood cell, a cluster of white blood cells. And you can see on this side, we have the absence of the key morphological features, which are there's no spherical nucleus here. There's no centrally located karyosome. This looks like a solid nucleus in this centrally located nucleus in the epithelial cell. This is a white blood cell, excuse me. And then an even distribution. There's no even distribution of peripheral chromatin, so none of that. On the right here, we do have a spherical nucleus, nice and round. We have dense, compact peripheral chromatin, and we have a centrally located karyosome smack in the center of that, giving it that bullseye appearance. Next, we have Entamoeba hartmanni, which is going to be the first of our non-pathogenic amoeba, which we need to distinguish from the clinically relevant Entamoeba histolytica. So this is non-pathogenic. It's morphologically very similar to Entamoeba histolytica with a few subtle differences. Of note is that it is also distributed worldwide and, like Entamoeba histolytica, is prevalent in the tropics and areas of poor sanitation. So one of the first things that we're going to notice about Entamoeba hartmanni is that it measures less than 12 microns, so quite a bit smaller than Entamoeba histolytica. But it also has a nucleus with an even distribution of peripheral chromatin, a compact and centrally located karyosome, a smooth granular cytoplasm, but also different is that it has no RBC inclusions as Entamoeba histolytica does. So here we have quite a small trophozoite. This is 10 microns in diameter. It looks like an even distribution of peripheral chromatin, centrally located karyosome. This also has no RBC inclusions. So because of the size, no RBC inclusions, it would lead you to believe Entamoeba hartmanni. The cyst stage is also quite a bit smaller, less than 10 microns, but it also has an immature to mature nuclei concentration of 1 to 3 nuclei on the immature side, up to 4 nuclei as the cyst stage matures. Like Entamoeba histolytica, it can also have a cigar-shaped chromatid bar present, so not a good characteristic to distinguish it from the more clinically relevant Entamoeba histolytica. Next, we have Entamoeba coli. It is also non-pathogenic. It is a little bit larger, at 10 to 50 microns, with a single nucleus. It has an eccentric karyosome, which is not smack in the middle. It's not going to have that bullseye impression. It has an irregular coarse peripheral chromatin. It is often vacuolated. It has a vacuolated cytoplasm, which can often contain yeast, bacteria, or other cellular debris. This is known as a dirty cytoplasm. And on the left here, we have a trichrome stain of Entamoeba coli with an eccentric karyosome and an irregular concentration of chromatin. You're not going to have that dense, compact chromatin as you would in Entamoeba hartmanni and Entamoeba histolytica. The cyst stage measures 10 to 35 microns and contains quite a few more nuclei, ranging from 8 to 16. So it was one of the quick giveaways of distinguishing it from the previous two organisms is the number of nuclei present in Entamoeba coli. It also has occasional splinter-like chromatid bodies. So it's not going to have that rhombus rod shape like Entamoeba hartmanni or Entamoeba histolytica, but more of a splinter-like chromatid body if present. So now let's play the artifact versus parasite game again. On the left here, we have an epithelial cell. It has no karyosome. It lacks peripheral chromatin. There's no peripheral chromatin around the edge of this. And the cytoplasm is granular and not vacuolated. So on the right here, the nucleus has a large karyosome. Boom, right there. There's an uneven distribution of peripheral chromatin. So uneven distribution of peripheral chromatin. And this organism is heavily vacuolated. We can see vacuoles there, there, and possibly there. So those are going to help distinguish E. coli, which is going to be more clinically relevant, even though non-pathogenic, from a very common epithelial cell. Next we have ENDOLIMAX nana, again non-pathogenic. The trophozoite measures 6 to 12 microns with a single nucleus. It has a large, irregular, blot-like karyosome, very distinguishing characteristic, and no peripheral chromatin. The cytoplasm of this species is granular and vacuolated. So on the left here, We have a trichrome stain of Indolimax nana, and we have a large blot-like karyosome. You can see right there in the middle of the nucleus, and no peripheral chromatin. So there's no peripheral chromatin surrounding the nucleus. The large blot-like karyosome, and the cytoplasm is granular and vacuolated. So maybe a couple of vacuoles here and here seen. And on the right, we have a cyst stage of Indolimax nana, which measures 5 to 10 microns. It has a spherical ellipsoid shape with 4 nuclei and large karyosomes. It also has no chromatid bodies. Next, we have Iotamoeba buschlei, which is again non-pathogenic, and the trophozoite measures 8 to 20 microns with a single nucleus. It has a centrally located karyosome, which is usually surrounded by achromatic granules. The cytoplasm is coarsely granular and vacuolated, which can also contain bacteria, yeast, and cellular debris, giving it that dirty cytoplasm appearance. And on the left here, we have the trichrome stain of Iotamoeba buschlei with the achromatic granules. On the right here, we have a cyst, which measures 5 to 20 microns with a spherical ellipsoid shape, a single nucleus, a large eccentric karyosome, and a large compact vacuole of glycogen. That is a very distinguishing characteristic of Iotamoeba buschlei. In the cyst stage, you get this vacuole of glycogen. So here's a chart to help distinguish some of the features of the clinically relevant Entamoeba histolytica from the less clinically relevant, SARCODINA. And lastly of the SARCODINA, the amoeba, we are going to cover NAEGLERIA fowleri. NAEGLERIA fowleri, also known as the tissue-dwelling amoeba, causes something very clinically relevant, very serious, known as primary amoebic meningoencephalitis, or PAM. It's found around the world and typically in warm, freshwater, low water pools. As the heat starts to warm up, the cyst goes, the organism goes from the cyst stage to the trophozoite stage, and as the water starts to recede, the organism starts to concentrate, which is why this is where you typically find infections. It is rarely found in humans, and infection occurs through trophozoites penetrating the nasal tissue, which then migrate to the brain through the olfactory nerves, where they then multiply and cause this symptom, primary amoebic meningoencephalitis. It is a very fatal condition. It's rarely seen in humans because the organism does not require humans to live off of. It is a free-living amoeba, which just accidentally serves as hosts for humans when swimming in lakes, shallow rivers during warm months when the water level is low. Morphology of this organism is 10 to 60 microns for the trophozoite. The cyst stage is 7 to 15 microns with a smooth and single layered wall. It has a single nucleus, and it is environmentally very resistant. Again, this is a free-living amoeba, and detection is occurs and unfortunately post-mortem, because the infection spreads so rapidly. Detection occurs through wet mount detection of CSF fluid, where you can see the motile amoeba swimming in the cerebral spinal fluid. So that's going to conclude the second of the 4-part presentation on intestinal protozoa, and we will pick this back up with part 3.